All right, welcome everybody to this webinar this evening. We have a panel of experts and we're going to be talking about what's new in enlarged prostate, also known as BPH, treatment. My name is Peter Byich. I'm the director of the section for men's health at the Glickman Urological Institute at Cleveland Clinic. I'd like to first start by introducing our panel of experts, all physicians at Cleveland Clinic who are specializing in BPH or prostate enlargement. We have Dr. Smita Day, who practices out of the main campus and also Beechwood. We have Dr. Reipthi Bole, who practices out of the main campus, Independence Family Health Center, and Middleburg Heights. And Dr. Brad Gill, who practices out of Hillcrest and Twinsburg Family Health Center, and also supports our veterans at the VA hospital. So what is prostate enlargement, also known as BPH? Well, BPH stands for benign prostatic hyperplasia. And the prostate gland is essentially a organ that sits below the bladder, and the urine has to pass from the bladder through the prostate and then into the urethra within the penis and then out of the body. The prostate produces a lot of the fluid that is present in the semen, and it's an important organ for reproduction. But after your reproductive years, it's a organ that just kind of causes issues and doesn't really have a benefit once you're done having kids. It's about the size of a walnut, and the prostate, like your nose and your ears, is an organ that just continues to grow the older you get. And prostate enlargement is a condition that the older you get, the more likely you are to experience. So it affects 60% of men by age 60, 80% of men by age 80. Some of the symptoms that might happen as a result of prostate enlargement include a weak urinary stream or a slow flow of urine out of the body, a sensation that the bladder isn't emptying completely, like there's more left inside that you can't get out, difficulty getting the stream or flow started, or having to actually strain to urinate, maybe urinating more often than you'd like to, perhaps during the day or maybe at night. Some people note dribbling after urination. You know, you take your time urinating and then you leave the bathroom and you feel it kind of running down your leg. Or sometimes just a weak urinary stream, even just at nighttime. Some men might feel that gotta go feeling, the urgency, and need to find a bathroom quickly. And some might not even make it on time. Some of the more severe consequences of prostate enlargement include developing stones in the bladder, developing urinary tract infections or bladder infections, urinary retention, meaning needing to have a catheter tube to drain the urine out because you can't pee, and potentially bladder damage or even kidney damage can happen as a consequence of prostate enlargement. What can we do about prostate enlargement or BPH? Well, one thing is, if you have some mild symptoms that are not bothersome, you don't have to do anything. You can always just wait and watch and see. Perhaps the symptoms might never worsen, but more likely than not, they're probably going to worsen with time. This is really a quality of life condition, and we really treat the symptoms. It's not a cancer or anything like that where we need to remove the prostate, but it's really all about quality of life. Men who have bothersome symptoms might consider taking a medication, but these medications don't fix the underlying problem. They have to be taken forever. And if you take the medication and feel relief and then you stop it, that improvement is going to go away. Many of these medications can have sexual side effects. The most common sexual side effect of prostate medications is dry ejaculation, or basically reverse ejaculation, where when you have an orgasm, nothing comes out because the semen is either not coming out at all or it's going backwards into your bladder. These medications improve your symptoms by relaxing the muscles of the bladder neck, which is a little valve between the bladder and the prostate. It's supposed to open when you want to urinate. And some medications can actually shrink the size of the prostate. Now, in recent years, there's been a lot of innovation in prostate procedures. A lot of new procedures have come out that seek to improve these urinary symptoms without the negative effects of medications and without having to rely on a pill every day for the rest of your life. Procedures and surgeries for prostate enlargement result in the greatest improvement in urinary flow and symptoms compared to other treatments. And it's an opportunity to stop taking medications. And many of these procedures are things that can be even done in the office with you awake, or outpatient procedures that you can have under anesthesia and still go home the same day. So next, we're going to have our experts kind of weigh in on a couple of the newer procedures that we have started offering at Cleveland Clinic. Importantly, this list is by no means exhaustive. We've done a couple of these webinars already and have reviewed a lot of different procedures. So in our slides, you'll see that there's going to be some procedures listed that we're not going to talk about. So you can always reference our prior webinars through our YouTube channel and see a little more detail on some of these other procedures. So one of the important questions is, which procedure do we do for which type of prostate or which type of patient? So we really tailor our approach at Cleveland Clinic based on, first of all, most importantly, the patient's goals and expectations, but also characteristics of the prostate itself. So we want to know what the prostate size and shape is to determine the best treatment options. To determine the prostate size, we might perform an ultrasound. Those are pretty commonly done through the rectum using an ultrasound probe. And we can also use a CT scan of the pelvis or an MRI if you've had an MRI of the prostate before. The prostate shape we can determine using what's called a cystoscopy, which is a little camera inserted into the penis after using plenty of numbing jelly, numbing medicine. That little camera allows us to see the inside channel that runs through the prostate. We can also get some information about the shape of the prostate from MRI. Sometimes we use bladder function tests called urodynamics. This is a way that we can measure whether or not there's a blockage between the bladder and the outside world, and how normally does the bladder muscle function. So that test can be very useful in helping us understand whether your urinary symptoms are from a prostate problem or a bladder problem. And as I mentioned, we really want to take into consideration the individual patient's goals related to their threshold for various side effects like dry ejaculation, whether or not they would be willing to have a temporary urinary catheter inserted for the immediate after surgery period, and whether or not they have any preferences with respect to anesthesia. Some people really want to avoid having general anesthesia. Others might say, you know what, I would much rather be asleep if you're going to be doing some kind of procedure to my prostate. So these are all factors that we take into consideration in determining what's the best option for you. So we're going to start with talking about procedures that can be performed in the office with you awake. And Dr. Smita Day is going to be talking about a device called Iend, which is a temporary prostate stent, also known as a temporary implanted prostatic device. There are a couple other procedures in this category, including water vapor therapy and prostatic urethral lift, which, as I mentioned, we're not going to be covering today just for the sake of time, but we have some other webinars available on our YouTube that you can watch and learn about those if you're interested. So with that, Dr. Day, if you'd like to take over.
Absolutely. Thanks a lot, Dr. Bryant. So hi, everyone. I'm Dr. Day, and I specialize in a number of these BPH surgeries. In addition to the Iend, which I'm going to talk about, I also do the Aquablation, which we'll hear about later today, as well as the whole-up surgery that we've discussed previously. So the Iend is a temporary prostatic stent. And that picture on that right side there, you can see that there's a metallic stent in the prostate. And so what this is kind of like a spring. So this stent is inserted into the prostatic urethra. The urethra is the opening in the prostate that urine flows through. When the stent is put in there, it springs open and it will enlarge that urethra to help improve the flow of urine, so making it easier to pee. So, this is something we often do in the office using numbing jelly, but we can also do it with light sedation in the operating room. This stent will be in place for about 5 to 7 days. And while it's in place, it makes gentle incisions into the tissue and molds the urethra into an open position. So there is a string that is attached to that stent, and that string kind of dangles out and is taped to the penis while the stent is in place. And that's what we use to remove the stent in the office after 5 to 7 days. Usually, we do not need to leave a catheter with this procedure, but there can be some discomfort while the stent is in place. Patients will notice an improvement pretty quickly after the stent has been removed, usually within a couple of weeks. And this option is good for patients who may have a small to medium sized prostate with a favorable prostate shape, or those who have a tight junction between the bladder and the prostate. One of the benefits of this procedure is that most men will be able to keep normal ejaculation afterwards. Overall, the side effects are pretty minimal. You may have a little bit of blood in the urine while the device is in, and some burning with urination. There's also a small risk of infection, so you will be given antibiotics while the stent is in place. But overall, again, this is a nice option for something that can be done in the office, in addition, again, to the UroLift and the Resume procedures that we've discussed previously. So I'm going to now hand off to Dr. Gill.
All right. Thank you, Dr. Day. So I'm Brad Gill. I'm another one of our urologists here who does a good number of BPH procedures. I specialize in essentially all the different treatments, so happy to help with whatever you need. And we'll jump ahead here a couple slides and then come right back to Optilume and Dr. Bole. So the green light photovaporization of the prostate, or the green light PVP procedure, is where you use a laser to go inside and melt out the inner portion of the prostate that blocks up the urine flow. So I always describe the build of the prostate to my patients as being like a watermelon. So the goal of this surgery is to go in and clean out all the pink fruit that's inside the watermelon. The white rind and the green skin of the watermelon stay behind. And the green skin of the watermelon is important because that's the part where the nerves are on the prostate that cause erections. So leaving that in place, we don't expect any change with erections with really any of these BPH treatments. That being said, traditionally, if you go in and you clean out the entire inner portion of the prostate, you lose ejaculation and you wind up with dry ejaculation, like Dr. Bayach mentioned. So what you can see here, there's the little laser that goes in, and we use that to clear out the prostate. So in traditional PVP or a green light, we would clean out all of this tissue in here. However, you can leave part of the prostate untouched. You can actually leave it behind to help preserve ejaculation in men. So you clean out maybe 80% of the gland, and then you leave this portion here that's near the ejaculatory duct in place. So the ejaculatory duct is this kind of opening, this little channel right here. And what that does is it carries the semen and ejaculate up from the seminal vesicles and everything, and then out into the urethra here so it can leave the body. So by doing this modified green light procedure with pretty good effect, you can preserve ejaculation in men, as well as have a very low level of concern that any erection problems would arise from treatment. The nice thing with the green light surgery is it's very quick, it's effective, it's an in and out same day procedure in the operating room. So you go to sleep in the operating room, you wake up, and you go home with a catheter, the tube that goes in through the penis into the bladder, just for one night. You're able to take that out usually at home the morning after surgery and save yourself a trip into the doctor's office. And then the other nice thing with the green light is it can be applied to a number of different shapes and sizes of prostates. So it's a very versatile treatment. aside from very, very large prostates, the green light procedure is actually a very nice approach to most cases of prostate enlargement. The other good thing about it too is by using the laser, it's a good treatment for men who need blood thinners, for heart disease or different cardiovascular conditions. And Cleveland Clinic being a big heart center, we obviously see a lot of those patients. So with that, I'll turn the microphone over to Dr. Bole here, and she'll review Optilume.
So I'm actually going to be talking about this real quick, and we're going to have Dr. Bole go into the Aquablation in a little bit. So I am going to just touch on real quickly probably the newest treatment that we have implemented at Cleveland Clinic that's recently become available. It's called Optilume BPH. Optilume BPH is essentially a procedure that is a balloon dilation of the prostate. So if you are familiar with how angioplasty works in the heart, when there's a blockage in the coronaries, they use a balloon that's coated in a drug to stretch open the coronaries, and then sometimes they place a stent, sometimes they don't. This is also a balloon that is coated in a drug, but this balloon is actually coated in a chemo drug. And in a moment, we'll get into why that makes sense. But the prostate is essentially, if we think of it as a structure that kind of has two lobes, and then there's a channel that runs within. The two lobes are attached at the top, and it's almost like a line between the two that is easily separated. And this balloon separates those two lobes of the prostate by inflating it and creates a larger channel within the prostate. The reason that the balloon is coated in a chemo drug is because that drug actually helps to prevent those lobes from fusing or healing back together so that the channel stays nice and open. So this procedure does not remove any tissue. It does not remove any part of the body. It is simply widening that channel within by stretching it open. The procedure is done under full anesthesia, so you would be out and you would have no idea what's going on. It takes probably about 10 to 15 minutes. It does take some time for that balloon to stretch things. Usually we leave the balloon inflated for about roughly 10 minutes. And because of that, that's why the anesthesia is necessary, because otherwise it would be uncomfortable during that time. And after the procedure, we do need to leave a catheter in. For this procedure, it's standard to leave the catheter in for 48 hours. And that's partly because there will be some blood in the urine. So we typically, in the recovery room, when you're waking up, we'll be flushing some fluid through the bladder to rinse out any blood that might be collecting. And then that's usually for about an hour. And once that looks okay, you'll be able to go home with the catheter for about 48 hours. Once it's removed, you'd notice an immediate improvement in the strength of the urinary flow. And with all these procedures, you usually see your maximum benefit after about 3 months. But with this, and with some of these other ones, you will see some immediate benefit. One of the main benefits of this procedure is that the likelihood of preserving the ability to ejaculate normally is very, very high, 96%. And it's a procedure that can be done for some prostates, but not all prostates. So this is good also for the small to medium-sized prostates that are, the right shape. So that's just a little bit about Optilume, and we already talked about this one. So now we're going to move on to really what's another category of procedures. These are procedures that are either same day or inpatient, okay, meaning that you have to actually spend the night in the hospital. And there's a lot of surgeries in this category, including TURP, HOLEP, and simple prostatectomy. Like I said, we won't get into those because those have been covered previously. We're really focusing on what are kind of the newest procedures today. So if you're interested in learning more about those, you can reference our other webinars that we've done. But next, we're going to be having Dr. Revathi Bole talk about Aquablation. Dr. Bole?
Thanks, Dr. Bayat. So hi everyone, thanks for joining us this evening. I'm Dr. Rafi Bole. I'm one of the urologists within the Center for Men's Health, and I also perform a number of these different BPH procedures. But today I'd like to focus on aquablation, as Dr. Bayach mentioned. So this is a procedure that a lot of men are interested in because it delivers a way to remove or destroy blocking prostate tissue in a heat-free manner. So this is interesting because the procedure is performed with a water jet, and that's kind of a novel and new technique that limits any kind of heat damage to some of the important sexual functions that we think about when we think about prostates and prostate tissue treatment. So I'll talk about the 3 general phases that are involved in the aquablation procedure, and we'll go through a few slides here to demonstrate what I'm talking about. The first phase is just the setup phase, which all of this is done while you're asleep in the operating room under anesthesia. In this phase, your surgeon uses a scope, which is called a cystoscope, to look inside the urethral channel and take a good look in real time at your prostate tissue, which is blocking your urine flow. So you'll see that up at the top of the screen here, the silver scope, and then the tissue in pale pink under it, that is the prostate tissue. Your surgeon will also use an ultrasound probe inserted into the rectal area, and that's going to give the surgeon a good idea of the prostate tissue that they can't easily see using just the cystoscope. And this is going to give them a nice view of the entire prostate and be able to use this view to map your prostate in real time as the robotic water jet is working. So this is the setup phase where both these scopes are inserted. Next slide. Okay, perfect. So this slide shows the treatment planning phase. Like I mentioned before, there is a robotic assessment that's done for the planning purposes to deliver this water jet treatment to the prostate tissue that is causing the blockage for you. So here we see just an example screen that your surgeon looks at in order to really customize and individualize the treatment pattern for your specific prostate shape. And again, they're doing that using those 2 imaging features, the cystoscope as well as the ultrasound, to be able to know exactly where that tissue is that's blocking you and how to deliver that water jet treatment accurately and safely. This last image shows the final phase, which is treatment of that blocking tissue. And this is done using that water jet that we talked about. And this image essentially shows how the green dotted contour was where the prostate tissue used to be, and you can see in this depicted image that the prostate tissue is now being removed using that water jet. So here you can see that pale pink tissue of the prostate is about 2/3 gone in this image. So you can see that you'd be left with a nice open channel using this water jet technique. Now, the last part of the aquablation that we haven't shown here is just to prevent any kind of bleeding after this water jet technique is performed. There's a very judicious use of spot cautery or spot heat treatments just to close up any blood vessels that are causing issues, but this is done in a very targeted manner. And so the majority of the procedure, as I mentioned, is done heat-free, which limits a lot of those bothersome sexual side effects that people can be concerned about. After this procedure is done, you'd wake up from anesthesia, and then you'd stay with us in the hospital overnight for most folks. So this involves a catheter being placed after the surgery, and then while you're in the hospital with us, we run irrigation fluid through that catheter to try and help get the urine light and clear and prevent any clots from forming. The next morning after aquablation, typically we're hoping to see that there is less blood in the catheter, and that for most people, we're hoping to take that catheter out and see that you can urinate before you go home. In some cases, it is necessary to leave the catheter in potentially an extra day, but for most people, if they are able to urinate that next day and do not have too much blood in their urine, we're trying to get that catheter out for you before you head home. So here, that's why we say catheter anywhere from 1 to 2 days on average. In terms of the results that you can expect, we say here immediate in the sense that the tissue that is blocking in your prostate should be removed at the time of the aquablation. Now, after the surgery, you still will experience some blood in the urine. You still may have some irritative symptoms. And so it's not to say that you'll feel perfectly back to normal just after getting your catheter out, but you should be able to detect a significant change and improvement in the way that you urinate. And what you'll see is that over the next days to weeks, that this feeling should get better and better. When we discuss those sexual side effects, one of those side effects that we need to think about is ejaculation for the men that do prioritize this and want to know what their risk is of having that dry orgasm after surgery. And we know that for aquablation, about 89 to 90% of men still keep their forwards ejaculation after this procedure. In terms of the type of prostate that's a good candidate for this procedure, well, the good thing about aquablation is that most prostates are good candidates for this procedure. I would say in general, whether you have 2 lobes to the prostate or 3, and even in many situations where the prostate is quite large, this can still be a good option for urinary symptom control.
All right. Thank you so much to all of our experts for your presentations. We really want to make sure that we spend the rest of the time here focused on questions. So we'll leave the slide up with the information if you want to get the contact info to set up an appointment with our men's health team. I'm going to start with a couple of the questions that were pre-submitted, and then we'll go through the chat box. So the first one is going to be for Dr. Gill. Can you tell me how green light laser with the addition of transurethral resection of the prostate, also known as TURP, compares to the treatment being discussed in this webinar? And maybe when going through that, you could just touch on, once again, how this technique that you've presented, which is kind of a newer thing, is different than traditional PVP or TURP.
Yeah, that's a very good question. So usually folks do not do green light and a TURP together. So some people may refer to them as the same kind of procedure. A TURP or a transurethral resection of the prostate, lovingly known as the roto-rooter, is where you go in and you use a hot wire element to shave out the inside of the prostate. The green light laser procedure, as mentioned, is where we use the laser to melt out that tissue. So they both really achieve the same thing. They use a scope to go in and clear out the tissue that blocks urine flow. Some people may refer to the green light as a laser TURP. That's also another source of kind of confusion for many patients when they come in. It's a common question they ask. The difference between the traditional TURP or traditional laser TURP or green light is that we're not cleaning out all of the pink fruit inside the watermelon. Back to that analogy for the prostate. We're just taking out about 80% of it and then leaving the parts of it near the ejaculatory ducts in place. So that way you get the benefits of improved urination by clearing out that tissue that blocks things. But about 80% of men will still be able to maintain their ejaculation after that procedure. With a traditional TURP or a traditional green light procedure, cleaning out all of that tissue also eliminates ejaculation.
Thank you. Next question is for Dr. Day regarding the temporary prostate stent. What happens when the stent is removed? What are the side effects of a temporary prostate stent?
Yeah, so the stent removal is pretty straightforward in the office. Really just takes a couple of minutes. We again use numbing jelly to do that. We use the string that's attached to the stent to remove it. And then in terms of side effects, overall, again, pretty minimal. You may have a little blood in your urine, some burning with urination. There is risk of infection. And then, there's always the possibility for something like this that, it may not have a prolonged effect depending on your prostate shape and size. But so far, folks have been doing well with it.
Thank you. Dr. Bole, who is not a good candidate for aquablation, and how long is the recovery time?
That's a great question because I know I said that most patients are good candidates for aquablation. I would say, actually, some of the men with very small prostates, prostates that, maybe in the 20 or 30 gram range might be people who don't experience quite as good a benefit from the aquablation. There are some men who have urinary symptoms that are due more so to a very high muscle tone at the bladder neck, for example, or a very high bladder neck, rather than having just a lot of bulky prostate tissue. So those men may not experience as dramatic as of an effect with the aquablation. But for most men with enlarged prostates of what we would call an average enlarged prostate size, or men with large enlarged prostates, the aquablation is quite a good procedure to help them with their urinary symptoms. Someone else who wouldn't be a good candidate for an aquablation would, of course, be anyone who can't undergo anesthesia. So someone who would not be a good candidate to be put to sleep in the operating room. In that situation, again, they would not be a good candidate for an aquablation procedure because that it cannot be done while you're awake or in the office. And that's where some of the office-based techniques may be more helpful. In terms of recovery time, I would say the catheter, like we talked about, is in for 1 to 2 days, and that's probably the most uncomfortable part. But of course, for that first night, for most cases, you're with us in the hospital, and we're monitoring to make sure that your catheter stays free of blockages. In some cases, there are men who, can go home the same day if their urine looks really good and they're doing very well. So again, the most people will stay overnight, but there are certain men who can go home the same day as well. In terms of recovery after the catheter comes out, you should be able to notice an improvement in your urination, but you do have some blood in your urine. You might have a little bit of debris that you can see passing out of the urine as you go home and recover. We always tell you to push plenty of fluids, try to get that urine as dilute as possible so that you're not bothered by clots or anything like that. And generally I recommend taking it a little easy. If you notice your urine is a little bloodier, take it easier until it clears up. If your urine is staying pretty light and you're hydrating well, you can still, walk around, you can visit with friends, you can go about your day. Because one of the main benefits, with procedures like what we've been discussing is that you don't have a surgical incision. So, all of these are what we would consider more on the minimally invasive side. And so there are no surgical incisions for you to have to deal with.
Thank you, Dr. Bole. Just to piggyback a couple things on the, who might not be the best candidate for aquablation. Dr. Gill mentioned that the laser vaporization is good for folks who cannot stop their blood thinners or who have to continue their blood thinners. Aquablation is probably not the ideal procedure for folks who cannot safely stop blood thinners, because the primary risk of aquablation is bleeding, which is why we like to monitor you overnight and wash things through when there is some bleeding, and sometimes there's not much and you can go home the same day. The other one is, prostates that are very, 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 very large. Although technically aquablation is an option, it may not be the best option because of that bleeding risk. Prostates that are much larger may be at higher risk of bleeding. So it's something that we take into consideration. Everybody has their own individual practice, but I'm usually up to about 150 grams, which is pretty large. I'll consider aquablation, but that's just my own personal practice. And like I said, there may be some differences. So I'm going to move on to a couple general questions. The first one, maybe Dr. Day, you can hit this one. What are the serious medical problems that can happen if I do not have treatment for my prostate enlargement?
Sure. So that's a question I get a lot, and that's very sort of dependent on each patient. If it's just a matter of symptoms, then, other than the nuisances of having the symptoms, probably not that much. But if you have progressive symptoms, that can cause damage to your bladder. If you're retaining urine, or if you're retaining more and more urine over time, that can cause damage to the bladder as well as to the kidneys. There is a risk of, we talked earlier about maybe bladder stones, so developing bladder stones or infections. And needing a catheter. If you can't pee at all, then you may need a permanent catheter or have to catheterize yourself. So those would all be things to, think about when you think about prostate symptoms that are getting worse over time, or if imaging is showing that you're retaining urine.
Thank you. Dr. Bolle, if I do not have surgery now, does that make having surgery later on in life less effective or more dangerous?
That's a great question. I think to go off of what Dr. Day was mentioning, there are, certain things, certain situations where you can have just watchful waiting or avoidance of surgery, and you may not really damage anything. But there are certain situations where not having surgery and waiting on it could make things worse in terms of bladder damage, or in very severe situations, if you have a prolonged blockage that's unrecognized or untreated, kidney damage or something of that nature. So as long as you aren't damaging organs like your bladder or your kidneys, you should be able to delay having surgery and still have it later on if you then change your mind, and still have a very good outcome if nothing has been damaged. In terms of surgery later on being more dangerous, no, I don't think that waiting on surgery would necessarily be more dangerous unless, like Dr. Bayach was mentioning, certain medical conditions crop up later on that might make you not a very good candidate to have some of these surgeries. So, for example, if you get put on a blood thinner later on, or if you are on a blood thinner that eventually your doctor says you can't come off of, or if you develop a medical condition, much later in life that makes you a poor candidate to have anesthesia because of the risk to your heart or lungs, those are the types of things that may, limit your success from surgery or make it a little more unsafe for you to have a surgery. But just from the standpoint of your prostate being a little larger later on in life, it shouldn't significantly impact you outside of the situations that we just discussed.
Thank you. Dr. Gill, is there anything that I can do before surgery to make recovery easier?
That's a great question. So, a lot of people come in and ask, what can I eat? What can I do? Exercise, lifestyle changes, things like that to help with prostate health. And the long and the short of it is really nothing. So, living a good, healthy lifestyle, a balanced diet, fruits and vegetables, not too many processed meats, red meats, and more importantly, regular cardiovascular exercise. Those are all things that just generally promote good health. And it doesn't matter what treatment you're having done, whether it's, prostate surgery, heart surgery, brain surgery, take your pick. You're going to recover better from it. You're going to do better in the recovery period and with your treatment if you're in good shape and you're in good health. So that's the advice I give most people, is just to really take care of yourself, live a good, healthy lifestyle, make sure you're exercising, because the better shape you come in, the easier it is to get through surgery, the easier it is to recover no matter what you have done.
Great answer. I'll take this next one. So with BPH, how does the balloon not block urine flow? And I'm assuming what you're referring to is the Optilume BPH. Now, this balloon that we use during the Optilume BPH procedure is in for 10 minutes while you're asleep under anesthesia. So while it's in and inflated, it does block the flow, but then we remove it, and that prostate, which has now been expanded, stays open, and we leave a catheter in for about 48 hours to help make sure it stays open. But once that catheter is removed, there's nothing that stays within the prostate. Okay. So let's see. Dr. Day, I recently had, and I know Dr. Gill has answered a lot of these already, but we'll just talk through them. So Dr. Day, I recently had the uroleft procedure with very little results. Am I a candidate for the stent? What's your
Yeah,
opinion?
that's so I think it's a little bit difficult to tell without further information. So, like we talked about, the stent is a good option, but for certain types of prostate, so certain sizes and shapes. So, I'd probably need to know a little bit more information before I could answer that. But certainly, if we fit within the parameters, then it might be an option, also depending on the goals we're trying to achieve.
Thank you. Let's see. Dr. Bole, are there any over-the-counter supplements that are helpful for BPH?
Yeah, this is a popular question. I think for supplements, the one thing to know about is that um, it's very difficult to get a standardized answer to this because supplements themselves are not standardized. There's a lot of different variation in manufacturers, between batches, even within a certain brand. Each batch may vary. How much active ingredient of that supplement you're getting, how pure is the quality. And so, when studies are done on supplements, it's very difficult to get an idea of how much active supplement folks are actually getting when they're taking these types of regimens to try and prevent or cure a certain symptom. I would say the supplement that's been studied the most in enlarged prostate and in urinary symptoms is something called saw palmetto. And so that'll be one that you'll see on most, if not all, prostate supplements that are sold either as a single ingredient or as a combination ingredient. And so there have been probably the most number of studies done on this particular supplement. And the result of multiple studies has actually shown that it doesn't really help much in terms of long-term improvement of urinary symptoms due to prostate enlargement. So there have been studies done that try to analyze the results of all the little studies done. So studies called meta-analyses and systematic reviews, specifically for this supplement, saw palmetto. And overall, they really have not shown as much effective symptom improvement as if you were to use a medication, a pharmaceutical medication, or have a definitive surgery done. The other studies that have been done on supplements in the literature, and there are a lot, turmeric, pumpkin seed oil, stinging nettle. I mean, take your pick. There are a lot of different ones that people are interested in. And I would say the research there is, again, not as strong as it could be due to the problems we just discussed, where it's very difficult to get a consistent dose into people so that you know exactly what they're taking. And again, there hasn't been much strong data to show and support that people should take one supplement versus the other. What I would say, though, is that the news is not all bad. In general, as long as it is a good quality supplement from a company, generally that you can trust, at least in most cases, taking a supplement should not hurt things.
Thanks, Dr. Bole. I'll take this next one. There are so many procedures. How will I know when I am ready for a procedure or which procedure is right for me? So that's a great question. And I think it starts with, first of all, deciding whether or not the urinary symptoms that you're experiencing are interfering with your quality of life. If they're mild and you feel like it's not a big bother, then it's probably not anything to worry about. But if you feel like your symptoms are really becoming a nuisance or they're interfering with your ability to do the things you want to do and go the places you want to go, then it would be a good idea to come and talk to a urologist who's experienced in dealing with prostate enlargement. And when it comes to figuring out, when you're ready for a procedure versus a medication, we kind of went through, that medications are meant to be a lifelong thing. They might work for some people, but not for everybody. If you're fine taking a pill every day for the rest of your life, and if the pill is working, then that's perfectly fine way to go. But if you prefer to avoid medications or are looking for more dramatic improvement and more permanent improvement, then that's where procedures typically are a better option. If you see a urologist who's experienced in prostate enlargement, they're probably going to have more than one tool available to them. And we typically start by doing some kind of evaluation. We like to find out what types of symptoms you're having, how it affects your quality of life, other factors about your medical and surgical history that might be relevant. And then a lot of times we'll try to figure out the size and shape of your prostate and try to figure out which treatments you might be a candidate for. So it's not necessarily the patient that chooses the procedure, but it's more so the prostate that chooses it. So by seeing somebody experienced that's able to talk to you about a couple different things, then I think it's a great place to start. All right, so moving on to the next question. Let's see. This could be a question that I'll try to make a little more specific. So the question is, how long did the beneficial effects of these procedures last? And, kind of depends on the procedure. But let's go to Dr. Gill. Maybe you can speak to PVP.
Yeah, that's a great question. So we actually did a research study years ago where we looked at different BPH treatments to see which ones held up the best and which ones needed further treatment, at what times. And it turns out the more tissue that you remove and clear out of the prostate, the more durable the result is. And that really holds across the spectrum of things because, we have tissues that are completely cleaned out with certain procedures like HoLEPs and simple prostatectomies and things like that. And then we have other procedures like the prostatic urethral lift where we just kind of move the tissues around. And then everything in between, procedures where you cut it, you remove part of the gland and those type of things. So with a green light laser procedure, if you go in and you really clean out the inside of the prostate, that may be good enough for some men to never need treatment again. However, some prostates are pretty big and you can't get all that tissue cleaned out in one surgery. So if you look at kind of our average at our institution, it's probably about 10% of men at 10 years of time will need to have some kind of other BPH treatment done if they have a green light procedure.
Thanks, Dr. Gill. So let's see. Oh, the other thing that I just wanted to piggyback on that was that a lot of these are new procedures. And when a new procedure comes out, there's some research that was done as part of a clinical trial that led to the approval of the device through the FDA. And every device is different as far as what kind of data is available. So for example, Iend only has 3-year data. So when my patients ask what's going to happen in 10 years, the simple answer is that I don't know. Other procedures have 5-year data. The older procedures, we have 10 and 20-year data. So it's really, having that conversation with your urologist, they'll work to kind of distill down what they think is relevant based on the options that are right for you. All right, so next question. It was commented that some of the procedures were not applicable for large prostates. What is considered a large prostate, Dr. Day?
So I think, we've talked a little bit that different urologists will have different definitions of large prostates. For several of these procedures, particularly those that are done in the office, about 80 grams or so would be an average cutoff. I think some people will go slightly higher. But when we're talking about large prostates, it's usually those that are over 80 to 100 to 120 grams. I think at those stages, a lot of these things like the stent or Optilume or Urolift are really not the ideal options and often not recommended.
Thank you. A general question. What % of BPH issues actually morph into prostate cancer or the need for a prostate removal? Dr. Bole.
Yeah, great question. I mean, I would say that these are two separate processes. So most men throughout their lifetime will have some degree of prostate enlargement that it will affect them. So by the time they're 80, the majority of men will have some degree of urinary symptoms due to their prostate enlargement. your prostate is going to grow forever, a little bit. And so the time at which it starts to bother you, and you might think, oh, I've been diagnosed with BPH, will depend on you, will depend on your family history, but this does not necessarily put you at risk for prostate cancer or mean that you specifically will get prostate cancer. So I wouldn't necessarily think of it that because you have an enlarged prostate that you're eventually going to morph into having prostate cancer. Prostate cancer screening is done first with a blood test. That blood test is called PSA. And so when you have prostate enlargement or BPH, you should still be having your PSA checked for prostate cancer screening. And then if that number is ever worrisome, or if you have a rectal exam, for example, and your doctor is worried about the way that your prostate feels, there's further testing that's done specifically to diagnose whether you have a prostate cancer. But again, this would be irrespective of you having an enlarged prostate. We do know that for men who undergo BPH procedures, some of them might have prostate cancer that hasn't been diagnosed as yet, that they may or may not ever have become aware of. And in some populations, particularly, and Dr. Day can certainly speak to this, being one of our experts who does the whole upper holmium laser prostate surgery, I believe the number is somewhere around 8 to 10% of prostate tissue when it gets removed for other reasons like prostate enlargement, where men sometimes are found to have a very low grade of prostate cancer. But again, I wouldn't think of someone with BPH as being now at risk for morphing into prostate cancer.
Thank you, Dr.
Yeah,
Pauly.
Dr. Bola, you're absolutely correct. So in my patients who undergo prostate enucleation, even if they've been completely checked, their PSAs and everything has been appropriate, we will still find what we call incidental cancer. So just by chance in about 8 to 10% of patients.
Thank you. I'll take this one. I already have the UroLift. Does that limit me on any procedure? And is there a next best procedure to try next? So UroLift is one, for those of you that don't know, is one of the minimally invasive procedures that can be done either in the office under local anesthesia or in the operating room under anesthesia. And these procedures, although they're great, don't always work. And the question is regarding if the UroLift doesn't work, what are my other options? Technically, many of these procedures are not approved for use in patients that have implanted devices in the prostate, which is what the UroLift is. And a lot of that comes from those studies that were performed when these devices and treatments were going through their FDA approval. However, there are a number of centers around the country, including our own, where some of these procedures have been performed on men with prior devices implanted in the prostate, like UroLift, for example. I can only really speak to my own personal preference for these patients that have had this. I tend to do Aquablation in men who have had UroLift. Many of the men who chose UroLift in the first place did so because they wanted to minimize the risk of dry ejaculation. With UroLift, that risk is about 1%. So Aquablation is a pretty well-suited procedure for those men. And the nice thing is that the UroLift implant is basically 2 pieces of metal attached by a suture or a stitch. And the Aquablation does a very good job of cutting through that stitch. And it really just allows us to just wash out the implants without causing any trouble. However, many other procedures can be performed, including laser vaporization, laser enucleation, transurethral resection, or TURP. So there are a number of options, and it's a good idea, just as I mentioned before, to see somebody who's kind of experienced with these different types of procedures so that you know what options might be appropriate for you. This is a good one. So are there recommended procedures for BPH patients that are also prostate cancer survivors on active surveillance? Dr. Gill.
That's an excellent question. So this is a hot topic right now in, the academic circles and research areas in those who do a lot of BPH treatment. What we know, looking back at historical studies and also looking at some prostate cancer active surveillance databases, is that it appears safe to treat BPH in men who are using active surveillance for prostate cancer. So we know that BPH happens more commonly in men as they age, and that prostate cancer happens more commonly in men as they age. So, just by the nature of those two facts, we're going to see more men who have low-grade prostate cancer and who use active surveillance who are going to develop BPH and need treatment for that. That being said, stay tuned. There's a lot of research and a lot of work coming out on this currently, but from what we know, it's very safe and very effective to treat BPH in men who are doing active surveillance for prostate cancer. In addition, you also get a little bit of a benefit too, because removing all that extra prostate tissue makes the PSA level a little bit more accurate and a little bit more sensitive for the prostate cancer. So there may be some potential that you can actually improve your ability to closely monitor the cancer. So
I'll add on a comment to that actually. Depending on what procedure you have done, some of these procedures do act like a biopsy, so to speak, for the prostate because you'll have tissue to send to the lab for pathology. So that can also help with looking at the cancer in those cases.
Thank you, guys. Next question. If I've been diagnosed with prostate enlargement based on digital exam, should I see a urologist just to make sure I don't need more action? Or do I just let the symptoms drive the type of medical doctor I should see? Dr. Bolle.
Yes, I think that if you've been diagnosed on medical exam by someone saying that your prostate's enlarged, but you never had any symptoms of urinary trouble, when you really sit down and think about it, you say, no, my flow is strong. I don't really wake up at night. I'm not going every, hour or 30 minutes. I really wouldn't have thought about it if someone hadn't told me about it. And you've also been getting your, prostate screenings and everything looks in order. You don't necessarily have to see a urologist. I would say that if you're having urinary symptoms and you've been told by your doctor that you have an enlarged prostate on digital exam, then in that case, it probably is a good idea to see a urologist just to know what your options might be. But again, if you're not having any symptoms at all, and everything is otherwise fine, you might not have much benefit from talking to your urologist about it.
Okay. Thank you, Dr. Bolle. To close it out, I'm just going to do one last question here. This one is because I want it to be a public service announcement, but the question is, does prostate milking help to avoid getting prostate enlargement? So prostate milking is actually applying pressure to the prostate to try to force fluid out of the prostate. And this is a historical practice that was done many, many years ago. And I think it's just worth mentioning this question, and that really there's no role for this in modern urology and modern management of prostate enlargement. And I know there's still some places around the country where this is performed, but just so you guys know, there's really no evidence to support this as a way to prevent prostate cancer or to treat prostate-related disease. So I just want to thank our esteemed panel here of prostate experts, and thank you all for tuning in. For any who maybe missed the beginning, this will be posted online, and you'll be able to watch this and share with your friends. And thanks again, and we hope to see you soon at Cleveland Clinic, and we're happy to help you with these issues. Thanks, everybody.